going to do a speech informing you about periodontal disease. I just want to ask you a question. Before the COVID pandemic hit and we actually were speaking to people without masks, have you ever noticed that people were kind of backing up away from you when you were talking to them? Have you noticed that you have bleeding gums when you're brushing or flossing? Any red or puffiness gums that you see inside of your mouth? Well, you, my friend, may be suffering from periodontal disease. All right? According to Mohammed Nazir from the International Journal of Health Sciences, periodontal disease is very prevalent in both developed and developing countries. It affects about 20 to 50% of global population. Periodontal disease is also a public health concern due to the high prevalence in adolescents, adults, and older individuals. Okay. I've been working in the dental field for 15 years now, and I will say that maybe 8 out of 10 patients that I have seen that came into the office presented with some form of periodontal disease, whether it be mild to more of the severe. My goal with this presentation is to inform you about the causes, prevention, and treatment of periodontal disease. First, I will talk to you about what causes it. Second, I will tell you how to prevent it. And lastly, I will explain to you about the treatment options for it. First, I will tell you the cause. All right? Our first major cause is dental plaque. And for those of you who do not know, I will show you a picture. Well, if you can see here, okay, so this white stuff, we kind of refer to it, I work with kids, so I refer to it like as sweaters on your teeth. This is called plaque, okay? This is not good. If it's not removed, it hardens. So this has to get off of our teeth. It forms every 12 hours, okay? So that dental plaque is actually bacteria, okay? And it causes inflammation. That's why you see the red puffiness, okay? Those are enzymes and toxins, and it destroys the periodontal tissues and lowers our host defenses. When dental plaque is not removed, like I said, it becomes a mineralized deposit, which is called calculus, and I'll show you a picture of that in a moment. Calculus adheres to tooth surfaces and is also called tartar. It's commonly known as tartar. You will hear that word. There are 2 types of calculus inside of the mouth. We have supragingival, which means above the gum line, and then we have subgingival, which means below the gum line. Okay, and that is according to the Essentials of Dental Assisting edition. All right, now let's talk about what causes calculus in the first place. So, according to the Mayo Clinic, calculus is plaque that forms on your teeth when starches and sugars in food, they interact with bacteria found in the mouth. That's why it is important to eat a well-balanced diet, okay? Staying away from too many starches and sugars, and to also brush the good electric toothbrush, and to, don't forget, our friend, floss every day. Okay, I'm going to show you a picture of calculus. This is a picture of it. Like we said, it is hard deposits. Okay, this is a picture of a patient that presented. This is a more extreme case, I would say, on the lower anterior. All right, this right here, it's like stone. It only can be removed by a dental professional. Okay, this is hardened plaque, so that this patient does not look like this patient was a good flosser or brusher. Okay, so that's all bacteria. Not good, and it's also not good for the overall health as well. Okay, so that person requires a deep cleaning, which we will talk about later as one of the treatment options. All right, so like we said, we need to brush and floss. Now, Now that I discussed the causes of periodontal disease, I will tell you how we're going to prevent it. Again, number one thing, good oral hygiene. It all starts at home. It is very preventable. A good electric toothbrush, okay, and also flossing, okay, very important. You're going to brush 2 minutes twice a day in the morning, and then you also are going to brush at night and floss at night. And you're actually going to floss first because flossing cleans away and loosens the food particles, okay, and the bacteria. Good oral hygiene prevents the development of an environment around the teeth that is favorable to specific bacteria that causes periodontal disease, according to the Mayo Clinic. Also, what is recommended, regular dental visits. Visit the dentist for cleanings. It's very safe right now, by the way, to go to the dentist. It is okay. We do follow the COVID protocols, and it's probably the cleanest place because everything is wiped down. Okay. So you want to go there, and that is considered your preventive visit. Your insurance a lot of times cover your preventive visits. So go to your dentist, okay? Also, people who would want to go regularly, who are under certain risk factors, such as dry mouth, from taking a lot of medications. People who smoke, they may need to visit more often as well. A lot of times, we will have patients come in every 3 to 4 months for maintenance, depending on what your dentist or hygienist recommends. Okay? So now that we covered the prevention and the causes, let's learn about the treatment that we have for the disease. Okay? There are different types of treatment. We have non-surgical and surgical. Non-surgical is a cleaning called scaling and root planing, or you may have heard it been referred to as deep cleaning. Okay? According to the Dentistry of Iowa, states that deep cleaning or root planing smooths the root surfaces and allows the gums and tissues to heal and reattach to the tooth. Okay? So it removes plaque and tartar deposits on the tooth and root surfaces. Helps the gum tissue to heal and heal the periodontal pockets, according to the American Dental Association. Dentists will also recommend medications to help control any infections or pain. They will also prescribe certain mouth rinses, pills, or substances, usually an antibiotic called Arestin, the most popular, placed directly in the periodontal pocket after the deep cleaning. If the non-surgical does not work, then we have a surgical option. And that is when the periodontal pockets do not heal after scaling and root planing. Surgery is going to be needed. Surgery can remove the inflamed tissues and reduce the damage to the bone, according to the American Dental Association. Also, it allows the dentist to get access to hard-to-reach areas that the cleaning cannot with the hygienist, under the gum and along the roots. Tartar and plaque can accumulate, so surgery can reduce pockets and repair the damage that was caused by the progressing disease, according to the American Dental Association. So, in conclusion, I wanted to tell you that, again, we did inform you about the causes, prevention, and the treatment for the periodontal disease. I achieved this by informing you on how you can prevent it, the things that you can do, what needs to be done as far as treating it as well. Okay? Now, I just want to let you know that if you feel like that you have the symptoms that were stated previously, please visit your dentist for an exam, and they will give you a personalized treatment plan as far as what they feel like the best treatment is for you. Thank you so much for listening, and you all have a wonderful rest of the week. Bye-bye.